Okay, Autumn. So what's the radiation monitoring device?
They are dosimeter badges.
Okay, and how does it work to measure the exposure?
So they differentiate between the different types of ionizing radiation. The most common type is the film dosimeter badge. What it is it's a small film enclosed in a light-proof case. That is very sensitive and to different types of lights. So you want to make sure that it's not stored in direct sunlight. You want to make sure it's not stored in the direct X-ray room, so it needs to be in a different room, and it needs to make sure that it is not worn by other people. Make sure it's only the person that it is assigned to is wearing it.
Good. And how do they obtain those readings?
We send those into a company that reads them for us. We send them in quarterly, and then they send reports, and we'll show you a report at the end.
Okay. And when should you wear your dosimeter?
Okay. The dosimeter needs to be worn anytime you're taking x-rays, and it needs to be worn at thyroid level on the inside of your apron, facing that side.
Okay. What's the maximum permissible dose?
It is 5,000 millirems.
Alrighty.
All right.
Thank you.
So now we're going to show a report, and I'm just going to turn this around. Okay, so what we're looking at here is a radiation exposure report. We're going to look at mine. So the deep is our deep exposure, which is like your tissues. The eye is your eyes, what it's exposed to. Shallow is like the skin. So these asterisks here on my name are actually, it was too low of a dose to be reported. So that was for our current, and then our quarter to date was the same way. And year to date, this is just for the first 4 months of this year. And then my deep for lifetime is 12, and that is the last 2.5 years. So that is how we read our radiation exposure reports. Okay, so now we're going to demonstrate how to put on our PPE. So before putting your PPE on, you want to visually inspect them to make sure that there's no cracks or anything in any of it. Same thing with the lead apron. And then yearly, the lead aprons and the thyroid collars get checked via x-ray for cracks. And then every 6 months, the gloves do. The gloves get checked twice a year because they can get bit by the animals as we x-ray them. So put our apron on and our thyroid collar. And then our dosimeter badge just goes at thyroid level. And then we put our gloves on. So we also available is goggles, x-ray goggles to help protect your eyes. We do not have them in our clinic, but they are available for use. So that's how we put on our PPE. So there are 3 methods to restraining. We have manual restraint, which is where the tech or the vet, whoever's taking the x-rays, physically restrains the patient by holding them down for the positioning and for the exposure. We have non-manual restraint, which is where we use positioning aids. Like here, we have the plastic V-troughs, we have like the foam wedge V-trough, foam wedges, sandbags or bean bags. We also have gauze. With the gauze, what you do is you can tie it around like their carpus and pull their arm out so that you're not in the x-ray beam. And then we have chemical restraint. Chemical restraint is where we sedate the patient, either just sedating or fully anesthetizing it. That would be the ideal way to get every x-ray if we could. That, however, is not possible with every single patient that comes in that needs an x-ray because you can't always sedate them. It is the best way because you usually just have to take the one exposure because you don't have to fight them to position them correctly. Okay, so time and distance can be utilized as well to help reduce the risk of radiation exposure. You want to use the ALARA procedure, which is as low as reasonably achievable. So you want to try to get the diagnostic image in the first view instead of taking it multiple different times. I know it's harder for the larger dogs so that you get the entire view, but as low as possible is what we want to do. And distance is staying away from the patient as far as possible. When you're manually restraining, it's kind of hard to get away, but you want to try to just lean away as far and look away from the primary beam. And then make sure that nothing's in the primary beam. So anyone under the age of 18 cannot participate in taking radiographs, and ideally women who are pregnant should not. So radiation exposure affects many tissues, including like skin, breast, thyroid, and also affects the bone growth centers. So this is why anybody under 18 cannot take x-rays. And then with women, radiation can affect the dividing of cells. So especially in the first trimester, that's when the fetus is doing the most dividing. So that's why, especially in the first trimester, pregnant women don't need to be taking x-rays if possible. If a pregnant woman does have to take x-rays, they do need to wear 2 dosimeter badges, one at their thyroid collar for them, one at their abdomen for the baby, and that gets reported monthly. And they cannot reach over 500 milligrams. So now we're going to do the craniocaudal x-ray of the radius and ulna. So what we're going to do is we're going to set them up in our system here. And the ID number, Jesus. It's a male. He's a young guy, but he has some kind of crooked legs, so we're just going to take a look at that, see if there's anything going on. Referring training. So we've got his ID number, his name, sex, his age, and then the performing physician, and then the body part to examine is the radius. Change this to a cat. Do a front extremity. Okay. Alright, so now we're going to take the x-ray. So to start out, we're going to measure the midshaft of the radius and ulna. I know, it's weird, isn't it? Hold on. So we can kind of see, measure there, and he is at 4 exactly. So we're going to put that into our system here, change it to a cat, front extremity. We're going to do a DB. He's at 4. So this automatically comes up with our KVP, MA, MAS. So what I'm going to do is I'm going to put him in sternal recumbency, pull his leg out with the gauze. That's going to be my positioning aid. And then the collimation is going to be distal to the carpus, and proximal to the humerus here. We're going to see how this goes because he's very, very playful. I'm going to come over here so we can see. Is going to be the midshaft of the radius and ulna. So I am out of the primary beam. Okay, so now we had to put Jesus up. He was not happy with being held, so we went and put him up, and I got back to the computer. Here's our x-ray that we took. I am going to just rotate it so that the digits are facing down so that we can see it very well. So there we go. Okay, so now we're going to do a VD view of the thorax. So we're going to put the patient in our x-ray or imaging program here. So I printed out her paperwork so that we would have everything here easy to find. So her ID number is 1988. Her family name is Moore. First name is Sasha. Female. Her birth date is 3/20/2009, and this automatically comes up with the age that we need. The body part to examine is the thorax, and you put in your performing physician, which is the one that's ordering everything, and that's Dr. Cindy Kidd. And that is everything that we need. So we're going to hit registration, and then we're going to go to register step and thorax, just so that it's on there, and we'll go on to the x-ray. Okay, so now we've got her here at the x-ray table. What we're going to do is we're going to measure her for our settings. Our machine actually, you put in her measurement of the width, and it automatically comes up with the KPA and MA, so it makes it easier. So we're going to do, you're a big girl. I'm going to do her VD, and see if I can keep it there. It's right at 29. We go with the centimeters. So what we're going to do is we're going to, her name's highlighted, so we're going to hit set parameters. We'll go to thorax, VD, 29. We'll go up to 29, and it automatically, see how it automatically comes with the so the KVP, the MA, MAS. So it automatically does that. So now what we're going to do is we're going to get her on the table. We're going to put her in dorsal recumbency. We're going to use the V-trough. We're actually going to use two because she's kind of big. So we're going to use the V-trough to help get us situated. And we are both wearing our thyroid collars, our aprons, and we're going to put our gloves on after we get her up on the table. For the collimation, the cranial part is going to be at the thoracic inlet. The caudal part is going to be at the first lumbar spine. Laterally is going to be her body wall. We're going to make sure that the V-trough is in it too, sorry. And then the crosshairs or the centering is going to be at the caudal border of the scapula. So we'll get that in and kind of show you where it's at. So let's get up there, big girl. Allison's going to do down there, she's going to extend her hind legs caudally, and I'm going to extend her front legs cranially as far as I can. Alright, we've got her straight, and I've got her up as far as I can get her stiff little legs to go. We're going to try to get it on an inspiration too, that's what you would like to get. Go towards you just a tiny bit more. Okay. But she is panting, so it may be a little difficult. Make sure we don't look. Alright, so she's a little over too far, so we're just going to redo that. A little crooked on us. It's okay. It's okay. It's okay. It's alright. Much better. Okay, so now we're going to look at the x-rays that we took. It took us a minute. We had to let her down on the floor because she doesn't like being up on the table. So this is the x-ray that we took. This is the first one where we were just over too far. So this is the good one. I'm actually going to turn it so that it is right, and we're going to there we go. Mirror it over so that the right side's on the right side, and you can see the marker right here. So we've got everything in there. Okay, so we're going to take the VD view of the canine while they're sedated. We're going to do Izzy today, so I'm going to set her up in our x-ray program. Put her ID number, her first and last name. She is a female, and she's 12 years old, and then our body part to examine is the pelvis. And then we hit registration, register step, dog, and pelvis. So what we're going to do is we're going to measure her at the widest part of her pelvis. We will put the it's the measurement in our settings here on our radiology program. It will automatically come up with the KVP, MA, MAS, all of that for us. Okay, so now we're going to do the OFA quality pelvic VD view. So we have our sedated patient here, and what we're going to do is we're going to measure. We measure at the hips. It's actually going to be this way, my bad. And we are at 18, so that will be here, and I have. We'll hit pelvic, we'll do VD, and it's going to be 18. And I do have my lead apron and my thyroid collar on. We're going to use these foam pads just to help me keep her in line. I'm going to put my gloves on here. So what I'm going to do is I'm going to put her in dorsal recumbency. And these foam pads are just going to lay up against her. Keep her there. I'm actually going to use a sandbag to keep her up. There we go. So our marker is going to be right along the lateral surface. So cranially, what our collimation is going to be is our collimation is going to be right at, we're going to pull the behind legs fully, and I'll get that here in just a second. I'm just going to get her situated here. We want her to be straight. And cranially, the collimation is going to be the cranial portion of her hips, the midline. It needs to be down the midline, and then the crosshair is going to be at the ischial tuberosity. So we're going to work just a little more. Got that in there. So what I'm going to do, and then the collimation caudally is just caudal to the patellas. And we're going to extend the back legs fully. And what we want to do is we want them to be parallel, and we want to rotate the legs so that the patellas go into the trochlear groove. Just gotta look up a little me. And then the collimation wide for lateral. We'll need just. You want this tail parallel with the spine. All right. All right, there we go. Okay, so I just wanted to clarify on the positioning and the collimation on the VD pelvis. It was kind of hard to hear me, and I was trying to hurry so that the pet wouldn't wake up from the sedation. So the collimation for the VD pelvis, the cranial is the cranial part of the ilium. Caudal is just distal to the patellas. Lateral is the greater tronchinus, and then centering is at the ischial tuberosities, and they are in dorsal recumbency. The legs, the hind legs are positioned, like I said, as caudally as possible. They need to be even, so make sure they're parallel, and then we rotate them inwards to make sure the patellas are in the trochlear groove. And then the front legs, are pulled up cranially as possible to help keep them centered and in line. So, and then the tail needs to be parallel with the spine. So that's the collimation and the positioning for VD pelvis. These are x-ray that we took of Izzy, the pelvis view. So got a little up higher than we actually need to. So we can actually crop that. We're just going to crop it down a little bit. And we can crop this in a little. Now our marker was actually not in the view at all. It actually got moved a little bit. So I'm just going to put in a marker. And this was the right side. So we're just going to put it here. That this is the right side. It actually goes right up up here. So here is our x-ray, here's our marker, and then we would also include the AKC number if she were AKC registered for the OFA quality x-ray. So there we go. So now we're going to look up a patient radiograph that we've done. We use digital x-ray here, so we're in our x-ray program right now. So to find one, what we're going to do is we're going to go to database, and let's just say you can search for ones that we've done today, today and yesterday, 1 week, 2 weeks, and a month. Or if you know their patient ID number, you can also search for it that way. So we actually I'm going to look at Dolly's, which we did this week. So we're just going to go for 1 week. We'll pull up Dolly. So we find her name right here. It says Dolly Fewens. I'm going to double click. It's going to move it into the viewer mode, and then just double click on each image and it pulls it up here. So we did abdominal x-rays the other day. So I'm actually also going to show you how to pull this up on our Cornerstone, which is the program we use throughout the rest of the clinic. This is just our radiographic equipment. So I'm going to DICOM transfer these to our IDEX packs and transfer all images, and I will show you how to pull it up on the IDEX packs. Okay, so now we're going to pull it up on our Cornerstone or our IDEX packs. So you can either go to the IDEX packs and go to your last 2 days, or you can search for a patient. So we can search for Dolly, maybe if I spell it right. There we go. So this brings up all of Dolly's, every Dolly that we have in here. So Fewens is the one that we're looking for, so we can double click on it, and this brings up all of the ones that we've done. These are the ones that we did on 7/3. We also took chest x-rays on 5/29, so it brings those up too. So those are really nice. And another way that we can do it, minimize out here, is we can go to her account. Go to Dolly, and it's actually going to come up on, it's going to be DCM image, so it's a DICOM image, and you just double click on it and it automatically pops it up. So those are the 2 ways we can get from it from their patient file. Okay, so now we're going to do a barium study on one of our clinic cats. It's a cat that we took in actually not having very good bowel movements. It doesn't eat very well sometimes too, so the veterinarian's requesting a barium study to be done just to make sure we don't have a blockage or anything. So what we're going to do is we're going to get 50 mLs of barium for his weight, and then we're going to take right lateral views at 0 minutes right after we give the barium, 0 minutes, 15 minutes, 30 minutes, 45 minutes, and then an hour, and then we'll do it hourly after that until the barium's at the distal end of the small intestine. So we'll measure the largest part of the abdomen. That'll be our measurement for our machine. We'll put that in the settings. That'll automatically come up with our KVP and MA. So and then from there, we will take the x-rays, then the veterinarian will take a look at them, see if there's anything, if exploratory surgery needs to be done, or if we need to do some further diagnostics with blood work or cultures or anything like that. Okay, so now we're going to put Pumpkin in our x-ray system here. So what we're going to do is we're going to go to register study. His ID number is 1624. His last name is Kid. First name is Pumpkin. He's a male. And we'll put his birth date in so it automatically comes up with his age, 24, 2010. We're gonna do upper GI. Our performing physician is Cindy Kidd. Okay, so now we're going to give the barium. He needs 50 mLs of it, so we're going to have to refill our syringe a few times. But we want to go really slow to make sure that he doesn't aspirate on it. And he may get a little angry, so we went ahead and wrapped him in a towel. He doesn't like being forced to do anything. So we're just going to slowly give him this. No, buddy, it's not good, is it? Okay, so we gave the barium. Now we're going to do the 0 minute mark. So what we're going to do is we're going to measure him at the widest part of his abdomen. And that is, it's kind of hard to see, but it's at 16. Now we're going to take a right lateral. We've got a cat mask just in case he gets kind of angry at me. Alright, so we've got that first x-ray and we can see it up here on the screen. So we're going to wait 15 minutes and then we're going to take another one. Okay, so now we're going to take the 15-minute x-ray. So again, we're just going to do a lateral, right lateral. And he's still not happy with me. Alright, so there's our x-ray, and we're going to continue to do that every 15 minutes until we hit the hour mark, and then we're going to do it hourly after that. We are starting to get a little busy, so I won't be able to film each one of these, so that is how we do a barium study. Okay, so now we're done with our barium study. We're actually looking at the x-rays now. What I'm going to do is I've already labeled most of them. I'm going to make sure that they are all labeled with the correct time that they were taken, just so that the doctor can kind of see it a little easier. And then we're going to let the doctor look at these and see if there's anything that we need to do for the patient. Okay, so here are our x-rays, just to kind of show you. We've got our right marker here. Some of the x-rays, he was fighting us a little bit. So some of the x-rays, the marker was kicked out of the view. So I just put in a marker, and then I put in that they had 0 minutes. And then same thing for these ones, 15 minutes, 30 minutes, 45, an hour, and then hourly after that. So there's our 2 hour, 3 hour, and 4 hour marks. So there is that. I'm going to let the doctor look at these and then we'll go on to the next step in treatment for our patient.
Hi, my name is Dr. Cindy Kidd. I'm a veterinarian at Mount Zion Animal Clinic and Boarding. Autumn is our veterinary technician student, and Autumn's been taking radiographs now for 3 years. And she is becoming more proficient. She's understanding where to place the crosshairs so that we perform the proper technique, and not turning the chest too far up or down so that the ribs are superimposed, and to make sure that we are getting VD versus DV views, and incorporating the thorax in the proper amount of technique, and using the collimator to make sure that it's not overexposing people or the animal. So she's becoming more and more proficient too with the limbs of the animals, so she knows where to collimate and get close in so that we're not, again, overexposing and getting more tissue than necessary, but the proper amount.